As West Michigan becomes more diverse, local hospitals are working to make sure all people get quality health care by offering new and different kinds of interpretation technology. 24 News 8's Coco McAvoy sat down with hospital personnel, learning more about how they respond in emergency situations when a patient doesn't speak English.
Good evening. Going to the hospital for an illness or an emergency is already intimidating. But for many of us, it can be as easy as checking in at the front desk and telling them what's wrong. But, ¿qué pasa si solamente hablo español y nadie me entiende?
The healthcare model is changing in that it's more patient-centered.
And that means meeting the needs of all patients, regardless of what language they speak. The Language Services Department at Spectrum Health has been around for 17 years now, with a staff of nationally certified interpreters.
We have 5 languages that we house in staff, and those are the main ones. We have Spanish, American Sign Language, Vietnamese, Arabic, and Chinese Mandarin.
The hospital also uses a phone vendor that can provide 200+ languages. And 2 years ago, Spectrum Health started incorporating these handy devices called mobile interpreting units.
And through this iPad, providers are able to dial a secure phone number that connects them through one of our own staff interpreters.
And the services are used much more than you may think. In fact, the hospital completes more than 90,000 requests each year.
If you look at it this way, when we provide care to our patients and families who come here to Spectrum Health, we want to be able to make sure we provide care that is of high quality and care that is safe. And in order for us to do that, it's very important for us to communicate very effectively.
For providers, it helps bridge the language barrier so they can relay important messages to patients regarding their care.
It's important for us to also be able to meaningfully have conversation with patients and families about diagnosis and treatment options and treatment plans so that they can fully engage as equal partners in their health care.
The reality is to be able to make sure that we can provide care to all our patients, because really that's our mission, to improve the health of the communities that we serve.
In Grand Rapids, I'm Coco McAvoy, 24-Hour News 8.
So very important. Mercy Health St. Mary's also has an interpretation services department. That hospital uses a phone interpretation system with more than 200 languages and has on-site interpreters.